Hello guys, good day. This is Anne of Reinforce Me Club. Today we're going to talk about phlebotomy, venesection, or bloodletting for hemochromatosis patients. Now, venesection is the removal of some amount of blood from patients for a therapeutic purpose. And for hemochromatosis patients, this is to lessen the excessive accumulation of iron in the blood to prevent complications and further damage. Now, it is important to note that this intervention is based on the physician's recommendation through their thorough assessment. This is to maintain and restore the balance in the body by removing the excess blood components. Now, the common side effects of phlebotomy are dizziness, feeling unwell, lightheadedness, nausea, and vomiting. On the side, sometimes bruising, especially if the patient is on blood thinners, and rarely hematoma. Now, let me explain the fainting, nausea and vomiting, lightheadedness. Now, our brain has the so called autonomic nervous system, which hugely involved in the involuntary movements of the body. And part of this is the vasovagal nerve. Vasovagal nerve is in charge of our fight and flight response of the body. This happens during our emergency situations wherein there is an increased heart rate and blood pressure and extreme focus on the situation with high adrenaline level. That is our vasovagal nerve. And that also happens when we're scared, really scared, and then we run like we can't think about the right thing to do. That's our autonomic nervous system. Other than that, vasovagal nerve is also responsible for the rest and the digest phase of our body, which means that it helps in the absorption and the digestion of our food, as well as our sexual arousal. And in the most part, the vasovagal nerve is actively regulating our heart rate and blood pressure. What triggers a vasovagal syncope? Now, when a certain amount of blood is being drawn from the body, there will be a sudden drop of blood volume. As a result of that, our blood pressure will also go down, including the heart rate. And there will be a venous pooling of blood in the lower extremity, leading to a reduction of blood flow in the brain. Other factors contributing to vasovagal syncope could be anxiousness. It means that the patient doesn't want to see a needle, medical equipment, or doesn't want to see his blood being drawn. Like, to be honest, there are some people who have needle phobia. Other than that, it could be the patient is exhausted or emotionally distressed. What happens before the vasovagal attack? This will take place during or approximately 10 minutes after the venesection. The patient may complain about feeling tired or warm, and you can see him looking pale. And during the attack, there will be a loss of consciousness, brief loss of consciousness, like around between 2 to 6 seconds, with the eye roll up, a little bit of twitching movements, and sometimes loss of bladder control. Then during the recovery phase, the patient may feel nervous or not having a feeling of being sick or nausea, with a pale skin, sweating, and an urge to go to the toilet. Now, how serious is vasovagal syncope? Actually, this is not a life-threatening event because it is a normal reflex of the body, which happens to be too strong and in the wrong time. The only danger to vasovagal syncope is when a patient passes out without a warning, and that may lead to injury. When you had your phlebotomy session done and dusted, then you experience a late untoward effects from the procedure. Don't forget to report it to the team so that they can weigh things out the next time around. Here are the top 6 tips if you're having a phlebotomy session. Number 1, drink plenty of fluids before and after the procedure. And it's way better to eat also before the procedure. Have a nice meal, especially if it's your first time. Number 2, take it easy. Have a restful time after the session. You might feel tired or lightheaded within 24 hours. Avoid using heavy equipment. No strenuous activities within 24 hours. Number 3, tell your family and your trusted friends that you're going to have a schedule for a phlebotomy in a certain date. You might need an extra help from them, like caring for your young kids. Number 4, arrange transport. You might feel too tired to drive or too tired to use the public transport, especially if it's your first time. You might also need a lift if it's your first time. For women, number 5, schedule a venesection when you are not on your period. This is to avoid uh, too much tiredness or loads of blood loss. Number 6, do not drink alcohol after the procedure until you have eaten. Now, this is Anne again from Reinforce Me Club telling you you do not lose, you either win or learn. Have a lovely day ahead.